Hi there, this is Chelsea Carshon from Well Medical Arts, and today we have this lovely patient coming in for a refresher of some Botox. Andrew, I'll have you take a look in the mirror. Let's assess from the last time you had Botox to see if we need to add more, take any out, because each time we really need to tailor that specific treatment to the patient.
Unfortunately, it's been a while, so it's completely worn off. I can't
off.
remember. So I can tell you my forehead's pretty wrinkly looking now. That's the thing that bothers me the most, I think.
Okay.
I can't see anything without me. My eyes seem like they're actually not bad,
Okay.
but I know that we've done my eyes before, so.
Let's have you smile real big with all those glasses off. I think we can still get your eyes.
Sure.
Probably about 12 units each side there.
Which is a light dose for a guy.
Yes,
Yeah.
very light dose. You can always start and add more too. So I'm going to start by getting you cleaned off, and then we'll draw on you and discuss how many units your face is wanting, and then we'll go from there.
All right.
Okay, so just cleaning here. And it looks like last time in your frontalis you had 24 units. Generally we can dose a little higher in men than women. On women we want to keep that arched brow, we want to keep it really light. And on men we can go a little higher with that.
Plus we have stronger muscles.
Exactly. Okay. So we're going to start by having you frown on down. Perfect, perfect. This muscle right here is the procerus muscle, causing that horizontal line. So we want to make sure we get that one. When he frowns down too, he has corrugator muscles right here and here. And his are pulling pretty good, where we could do 5 and 5, which is a total of 20 units in that glabella. And then I'm going to have you relax, and now you can raise on up like you're surprised. And this is the frontalis muscle. It pulls up. When we relax it, it pushes down. So we also want to make sure from his last treatment, you weren't too heavy with your treatment of 24 units last time.
Like I said, I let it go a little long, so I can't remember.
Okay. So I'm going to have you raise on up, and we're going to make these points. Go 2, 4, 6, go 8, 10, 12, 14, 16, 18, turn towards me, perfect, 20, 22, and this one I'm going to go horizontally here. So when we stay nice and high, that helps prevent that droop of feeling too heavy. We want to make sure in men and women that we're getting it up high enough. So raise on up for me. Perfect. That we're not chasing, we want to make sure we chase wrinkles here. So we don't want him to be smooth here and have wrinkles back here. So we'll stay nice and high on him today, and do 24 units in the frontalis, 20 units in these corrugator muscles, 5 units in the procerus, and then we'll do around his eyes here. The eye is a sphincter muscle, so it wants to constrict. So by putting in Botox, we relax that muscle. It helps open up the eyes as well as get rid of some of these crow's feet. So smile real big for me. Perfect. And then turn towards me. Perfect. Perfect.
And I don't have bad crow's feet. A lot of guys have way more
Way
crow's
more.
feet.
It's because you've been doing your Botox. You're doing
Oh,
your
yes,
preventative
that's
work,
why.
right? So I'm going to ice. You can relax your head on back on the table. Perfect. You let me know right before it gets
It's
too
good.
cold.
It's
It's
frozen.
good. It works
ice
pretty
isn't-
quickly.
Yeah, the ice isn't for pain.
And breath in and exhale. Yeah, the ice is actually to help constrict those blood vessels, so less bleeding and bruising. Breath in and exhale. Good job. Get that other side nice and cold.
And it's not necessarily a pleasant experience, but it's not bad.
It's not too bad. We use
No.
tiny, tiny little needles. It's just under the skin. It's not deep.
You're good.
And. and breath in and exhale. Good. And breath in and exhale. 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 And breath and breath in and exhale. Good.
Not only do we use tiny little needles, we change them out constantly, so you're always getting a fresh needle.
Yes. Get this side of the frontalis.
Good. I almost forgot. I started getting ahead.
And these are just tiny little blebs, just 2 units each spot. So tiny, 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 tiny.
And just a tip, pro tip. If you let the ice go too long, it hurts more than the Botox.
That brain freeze feeling.
So pay attention to the ice.
Up the other side, so we've done half of his frontalis muscle, and everyone's frontalis is different, so where we draw our dots on each person or where we inject is different on everybody. There's different patterns we can do, and it's to accommodate each person's specific anatomy, so that's real important. Okay, breath in and exhale. And breath in and exhale. And then we'll talk a little bit about aftercare too. So you don't want to lay down after. I'm going to ice a little bit more here. The reason is we want this Botox to stay in the muscle we put it. We have precisely put it in right where it needs to be. We don't want it moving around. So no laying down, taking a nap. Exercise after. If you can avoid strenuous exercise for about 24 hours, that's really helpful. It allows time for that Botox to start working. And breath in and exhale. And breath in and exhale. Breath in and exhale. And breath in and exhale. So frontalis is done, glubella's done. We'll get that procerus, and then we'll do the crow's feet.
Crow's feet are the worst.
A little more spicy in that area, yes.
They're not that bad. They're just the worst.
That's when the ice can sometimes be used
Yeah.
to help distract the brain.
Yes. And when I say worst, 1 to 10, it goes from a 2 to a 3.
Just feel it a little bit
Yeah,
more.
just a little bit more. All right, good.
And the procerus, breath in and exhale. Good, good. And I'm gonna get a fresh ice pack for this one.
Fresh ice packs, fresh needles for around the eyes.
Fresh needles, yes. We actually put our Botox in these tiny little insulin syringes. So each area of the face, we have only a few units in it. So we get a new needle each time. And we use a separate one for each side of the face too. So you get new needles, which is a little less painful when you get poked.
I'm good. And minimizes the bruising.
And breath in and exhale. Breath in and exhale. And breath in and exhale. That side's done. How was it?
Yeah.
Not terrible.
It's not, doesn't hurt that much. Like I said, it's not pleasant, but it's not bad.
And you can see I didn't go as deep when I injected here. You can see a little bit of that raised. That's going to go down within the next 10-15 minutes. That's just the product right there. So by the time usually you leave the office, everything's looking back to normal. Okay, cold, cold.
Okay.
Okay. come around for this one. And breath in and exhale. Breath in and exhale. And breath in and exhale. Good job. So that's a simple Botox treatment with the frontalis, the glabella, that procerus, and the crow's feet. So this will kick in anywhere between 2 and 7 days. It really depends on each specific person. Takes usually maximum effect at 2 weeks. And then he'll come back in 3 months, right, for more?
I'll be here.
We'll force him in the chair.
Yeah. Thank you, Chelsea.
You are welcome.